September is Childhood Cancer Awareness Month, focusing on helping and raising awareness for those who currently are patients and survivors who were diagnosed as children.
A lot of progress by doctors and researchers have been made and continue to make strides towards a cure. And with more on raising awareness, the successes, and the challenges in childhood cancer is Dr. John F. Kudish, along with Shanda D'Antonio, who's a pediatric nurse for the UNM Children's Hospital. Thank you for joining. Also my sister.
Also your sister.
Yes.
Thanks for joining us. So, Doctor, let's talk a little bit about the role of clinical research and how it is leading to survival rates and increasing that for kids.
Clinical research, as you know, is really research that involves patient. This is centered around the patient, centered around studying the disease in the patient. Clinical research has been really a key part for us and actually for the kids and how well they're doing now. Childhood cancer survival went from about 5% in the 1970s to now it's over 80% for 5 years or more.
Wow.
That's incredible.
The reality is we wouldn't be able to do it without the patient and the parent participating in that.
Yeah.
And you have to realize this is voluntary. Clinical trials, clinical research isn't an obligation of the family. It's a voluntary participation. So the success of childhood cancer is really from the child, from
their
family.
participation.
Yeah.
Yes.
So what are some of the challenges in improving the outcome?
The challenge is that we have such large survivors, number of survivors. About now predicted 1 in 750 young adults are survivors of childhood cancer. The reality is they survive their cancer, but over 2/3 of those patients have some chronic problem or chronic effect or chronic disease from the treatment and from the cancer. So one of the challenges is, can we improve the therapy or change the current treatments to decrease that chance? The other aspect is still 20% of those patients do not do well. And
well, in growing some of that, the increased response to this and decreasing the numbers and increasing survival rates for cancer is a multidisciplinary approach, getting the community involved as well. Shanda, let's talk a little bit about that and how that is helping curb the disease.
You know, when a child gets diagnosed with cancer, people think that it just affects that child and their family, and that's just not the case. It really affects the entire community. There's so many people that are involved with one child who gets cancer. There's, the doctors and nurses, radiologists, surgeons, social workers, the New Mexico Cancer Fund. But also what we really want people to know is that the community, it affects the entire community. We need the community to really help us out and step up and help with not just donations, but sponsors for fundraising, and also people who can just step in and help these families when the families are stuck at the hospital. They're sometimes losing their jobs, electricity is going out, the bills here, bills there, and you're stuck at the hospital trying to take care of your child. And we need the community to come and help with things like that. There's just so many things that the community can do to help us, as well as everybody else in our team. And so we really need that.
If somebody wants to donate, where can they do that?
there's various funds in the community that are available. There's means through UNM to donate that can be directed to child support, that can be directed to clinical research. I think, again, one of the community funds is the Children's Cancer Foundation in New Mexico, which is local. There's the Wimbish Fund, which is in Farmington, but there's other funds and there's other families and other donors that donate directly to us and can direct their funding there.
Well, there's a lot of different links, of course, to this, and of course we will have those links at CASA.com. Just click on the Style tab and you can get out and help. It really does take a village to make this thing go away. Stay with us, folks. We'll be right back with more Style.